Hello, everyone. This video is to go over the case study assignment for your midterm, part one and part two. Everyone has their feedback and their grade for their midterm assignment. What I noticed in the grading process is that many of you completed, not many, but a good handful, I would say, of students completed the sample one and used the sample one for the template instead of the actual guide, which is a several page document that has several sections. Because the original document, the blank document, has so many sections, it was removed from the original assignment and made as a separate assignment. So in acknowledging how long the case study guide is and how many sections you have to review, I decided to make them into two separate assignments through feedback from other classrooms or other courses that I've taken. And so many of you all only completed a portion of it, which is actually about half of it. And you utilize the sample, which is not a blank guide. The guide is a blank form with several sections to it. The sample is not the guide. The sample just gives you an idea of how to fill out sections. And it's just a guide to give you some idea of how to complete it. And so somewhere there was a lot of, or some confusion that the sample was the actual guide. I'm a little confused about how that was done, especially considering that I went over the assignments in an earlier video in the course, and I showed the differences between each guide. But with that being said, that is what happened with some of the papers that I looked at. Not all, and many of you all completed the correct guide and answered all of them. In addition, some of you all had reached out to me before the assignment was due, catching their mistake and realizing they only filled out the sample. And then I reopened the assignment again for those who reached out to me asking, can they submit the right one because they filled it out incorrectly, and I did that as well. So I want to talk a little bit about part two. So part one, you're supposed to do a comprehensive case study guide, filling out the Howard University case study guide. Part two, you're supposed to extract the information, the relevant clinical information from the study guide, and then write up your case study. And so I'm going to talk a little bit about the sections of it and what I saw in terms of the papers and the assignment. If I'm looking down, it's because I'm reading the sections as I talk it over with you. Part one is presentation of case information and intake information. So this is understanding the key clinical presenting problems for the client. And you use that key information from the case study guide to make a justification and to make a strong position for your DSM-5 diagnosis. So this requires you to identify the key facts, the key observation, key report, key symptoms, key behaviors, feelings, emotions, thoughts, all the things that were clinically relevant in your case study guide. And you use that information to present your case information. This is not a comprehensive discussion of your client in terms of where they were born, what neighborhood they lived in, who were the people in their family. That is not what the presentation of case information is. It is identifying the key factors in that case information that you're going to use to set up the justification for your diagnosis. Again, this is leading the reader into the diagnosis. And by the reader, particularly myself, reading the case information that you're presenting, I'm starting to conceptualize and decide what the diagnosis is based on the behaviors you're identifying and the presenting problems reported by the client, or again, the clinical relevant data that you feel you're making a case for that DSM-5 diagnosis. Once that is done, you move on to the next part of the assignment, which is identifying the DSM-5 diagnosis. If you did this part correctly, you listed the DSM-5 diagnosis. You should include the diagnosis and any codes. All the information for the diagnosis is necessary. Then list all the symptoms of that diagnosis, as well as the criteria. This is the part where you're demonstrating you understand what this disorder is and you understand all the symptoms and criteria for the disorder. Students who did well in this section, again, included the DSM-5 disorder and listed all the symptoms and criteria. And why is that helpful? Once you list all the symptoms and criteria for the disorder, now you're going back up and you're checking what you wrote in part one, which is presentation of case information. You should be able to demonstrate in that presentation of information how that client meets the symptoms of that disorder. So, for instance, if a client is suffering from depression, you might have wanted to mention in your presentation of case information that the client is suffering from weight loss, irritable mood, um, uh, pervasive sadness most of the day, almost every day, insomnia. You might want to demonstrate that. Now, what does that mean? That doesn't mean you take the DSM-5 symptoms and you just list them in the presentation. No. What you're doing here is you're demonstrating by what the client is reporting, what is going on that the client is not sleeping well, perhaps, or how the client is interacting with their family, peers, or coworkers that may be an irritable nature. Client may be disclosing lack of appetite as well as a corresponding weight loss with that. So again, the presentation of case information should align directly to the DSM-5 diagnosis. Once you write out the DSM-5 diagnosis in full, you're to go back up to the presentation of case information to make sure that once you've listed all those symptoms required for the diagnosis, you can then go back up to the presentation of case information and say, yes, I've adequately. So once you write out all the symptoms, you should be able to demonstrate that the client in your presentation of case information met that criteria. So again, you are presenting the case information, writing the diagnosis down and criteria, and then you're going over each of the symptoms or the symptoms required to make the diagnosis, and you're making sure you capture that in the presentation of the case information. That is what we mean by presenting clinically relevant data. Now, does that mean that you can't talk about social situation? Does that mean that you can't talk about environment in terms of family, neighborhood, community, school? No, that doesn't mean that. You can definitely present that information, but you have to demonstrate how those other factors directly align with the symptom, or make a justification of why that client's experiences is leading to whatever the symptoms you're discussing and ultimately the disorder that you are mentioning. In this situation, you cannot rely too heavily on the social situation to make a diagnosis. You're not diagnosing the social situation, you're diagnosing the client. So you may have a client that has a history of domestic violence or abuse, right? And so you might feel compelled to make a diagnosis of a trauma-related disorder. However, if the client is not presenting with any trauma symptoms, you can't diagnose the situation, you have to diagnose the client. The client is not reporting or identifying any of the symptoms or behavior or even identifying stress or trauma as an issue for them. Even though their situation may be traumatic, you can't provide a DSM-5 disorder for trauma if the case justification doesn't demonstrate that, for example. Another thing you want to make sure that you don't do in presentation of case information is you don't want to rely on the clinical observation of another provider or clinician. This means for this assignment, you are trying to grow your own clinical skills. You're trying to develop your own observation skills, conceptualization skills, understanding of presentation of information, and your ability to be able to identify key symptoms in a case presentation, and being able to make a strong and accurate diagnosis based on the presentation of that information. And again, that means that you are not to rely on the diagnosis that was already provided for your client. I want you to use your clinical lens and make that diagnosis. The reason why that was stressed, and I actually listed that in a prior announcement earlier in February, is because oftentimes I've seen students submit diagnoses based on clinical information that was provided um, by the agency or the organization, and the symptoms did not match up to the disorder. And so because that has happened more than once and more regularly than I'd like, and we would consider that misdiagnosis, I want you to rely on your clinical skills. I feel like our students here at Howard University are just as confident, just as skilled, and have the capacity to make good, sound diagnosis. They just need to work on those skills and to improve upon them. If you didn't do well in those two sections of the assignment, that's okay. And the reason why that's okay is that's what you're meant to learn in this course. The goal is for you to grow these clinical skills, and you have two opportunities to do that. One is with this assignment, and the next one is with our last assignment. You do it a little bit with the group presentation too, but the group presentation doesn't rely as heavily on the presenting of the case information. I just need a little bit of that, but you're focusing more on that disorder for that group assignment. But you are providing some kind of context in which to base the disorder in for the group assignment. So again, you get two opportunities. And I would like to take the time to go over this assignment with you because you will be doing it again to a certain extent for your final assignment. And so to understand where you went wrong or how to improve upon your paper is very important. And that's why I'm taking the time to go through this with you. So again, part one, presentation of clinical information, key clinical information, and two, how do you go about making a DSM-5 diagnosis. The other good thing is once you list all the DSM-5 symptoms and then you go back and you make sure that you can clearly see those symptoms in the presentation of your case information. And again, in not just listing the symptoms, but really demonstrating how that person's interpersonal interactions are demonstrating the symptoms, how their self-report is demonstrating their symptoms, how their cognitive processes are perhaps demonstrating those symptoms, and so forth. The other good thing about listing the DSM-5 diagnosis is sometimes you'll find out that as you're going through each of those symptoms, you're starting to have this aha moment to where you may be thinking, wait a minute, this is feeling a little odd. I wrote something up in the case presentation information, but now that I'm listing out these symptoms, it's not really aligning or integrating well with what I presented at the top. That's usually a red flag that you might have the wrong disorder. And then you might want to look at other disorders that are in that same category, such as mood, or other disorders that are in that same category, such as trauma, to see if maybe there are other disorders that align more um, consistently, um, more efficiently with the case presentation information you listed. Um, Also, thinking about in the case study, the type of information that you need to make a valid diagnosis, how many of the criteria was met, how many criteria wasn't met, all those things are very important um, in building and making a case for your client and the presentation of the information. The assignment also included presentation of historical interventions. This is for you once you have a firm DSM-5 diagnosis. Talk about what are some of the historical interventions and treatment, particularly those that are evidence-based for that disorder that you pick. This would require you to refer to the readings that you've had in the course up until this point, and be able to talk about what you know to be historical treatment options specifically for that disorder. Again, reference your readings where you talked about where it covered some of the historical significance of the disorder as well as the evolution of that disorder and how we think about it and how we treat it today. So that historical discussion needs to take place in your paper as well. One key thing to note and to think about here is your discussion boards, the type of content that you are covering. We're giving you little exercises to prepare you for your major assignments. If you want to, if you're thinking or reflecting on why it was so important for you to um, utilize APA format inside your textbook, it's because I wanted to make sure that you are always grounding your thoughts, grounding your opinions, grounding your work in the required textbook. Also, when it comes time to write up your major assignment, you will be familiar with the areas that your textbooks have already covered. And then you can then refer to those areas to write about the key discussion points in your case study, specifically related to the DSM-5 disorder, because you have that as one of your required textbooks, and the historical treatment options should also been in your reading. So making sure that you cover those in your reading is why it was very important. And I was stressing throughout the course, it was important to get the books, important to do the reading, important to cite those textbooks for your discussion boards so that you have the content and you know the content because you've read the content. And so you can cover these areas hopefully a lot better and easier and more efficiently in your paper. So you were supposed to discuss historical treatment and interventions. Also discuss risk and resilience assessment. If you look in your Blackboard folders, there was a folder uploaded that talks about risk and resilience. We're talking about risk. What are some of the things that can cause your risk to your client in terms of triggering their symptoms, worsening their symptoms? So you want to think about how you presented the case information, refer back to the case information, and have a good discussion of what are considered risk for your client. And again, these are risks related to the disorder. So if your client is suffering from depression, what are some of the things in that client's life that may serve to exacerbate or worsen those depression symptoms? If the client has a stressful and overwhelming employment situation, if they were repeatedly laid off of work, can't find work, poverty, all those things can be potential risk factors for that particular client, and risk factors not just for the client, but risk factors in making those depression symptoms worse. And you can specifically talk about how each of the risks may impact any given symptom that you've identified in the disorder that you identified for your client. When you're thinking about resilience, um, you want to think about those factors that help that client cope through the disorder and or the symptoms. What are some of the things internally or external resources that client has that has helped them be resilient? And again, you are always referring back to the presentation of that clinical case information to make this call. And or you may be going back to your case study guide specifically to try to have a better understanding of what those resiliency factors were for that particular client you are talking about. Strength-based assessment techniques, again, you could refer to your case study guide and talk about what are some of the assessment techniques you use to understand what the client's strengths were. Or talk about, specifically the identified strengths that you saw in the client if the client was not able to articulate those strengths themselves. Discussing the future without the problem and building motivation section of your paper was meant to make sure that you talk about how would life look if that client was not experiencing those symptoms, and or what would a life look like society-wide if we had can improve outcomes or eradicate the disorder that you are mentioning. Contemporary responses and evidence is are when you think about that, that's your interventions. What are the recent evidence-based interventions, for example, for depression? Is it cognitive behavioral therapy? Is it antidepressants? But you want to make sure that when you're covering these sections, that you're having a comprehensive discussion. That needs more than one or two sentences. You really want to go into depth and demonstrate your knowledge of these areas, and being able to articulate that and discuss it well in your writing is key. With reference to your textbook, the required textbook, again, why, as we started the class, kept really focusing on having those, um, uh, having referencing the the textbook as often as possible for that. Even when you're thinking about, and again, when we're talking about historical treatments and or contemporary or um, modern intervention responses and evidence to that, having comprehensive discussion in those areas and providing as much detail as possible is key. To talk about a current response as being an antidepressant is good. Listing specific antidepressants by their name is excellent. Talking about interventions such as group therapy or psychotherapy is good. Providing specific treatment modalities that include psychodynamic uh, therapy is excellent. So you want to do more than just talk about broad or umbrella terms when you're thinking about intervention techniques. You want to be specific, and not just specific in terms of this. These are the current treatments, evidence-based treatments for this disorder. You also want to talk about which one of those treatments may work best with your client and why. So again, you want to constantly take the sections of this paper and constantly align it back to your case presentation and your client. So again, if you're going to talk about antidepressants or some type of pharmacological medication for your client, you might want to be specific and talk about, well, this client may benefit from medication because this client is suffering from depression, and antidepressant medication would probably be ideal for this client. Examples of antidepressant medications are this, that, and the other. So again, this is your opportunity, all assignments, to showcase and demonstrate to the instructor what you know, what you've been learning through your required textbook. And so that is what is needed when you have comprehensive discussion in those areas. Um, Critique of the diagnosis. Critiquing the diagnosis is now taking a look back at the DSM-5 diagnosis and identifying limits in your diagnostic. So when we talk about that, you're looking at whether that client met all the symptoms required for that diagnosis or not. So one way you may approach this is talk about some of the symptoms that the client did not meet. Another way to approach it is talking about maybe some symptoms that the client is experiencing, but how those symptoms may also be um, are also similar to another disorder. You can talk about environmental things, which some of you all did, but you can't get off of the topic of the diagnosis. So it's okay to um, add something like um, you can add something about how the environment may have limited your ability to do a good assessment. You may talk about having not enough information to make a full disorder. That is okay, but that cannot be the extent of your critiquing of the diagnosis. Critiquing of the diagnosis is really you're double checking to say, hey, wait a minute. There are some other things that the client presented to me that may have aligned with another disorder, but I think I'm going to stick with mine because, and this is the reason why. But again, critiquing the diagnosis is going a step further. You know, most of the paper has been up until that point is justifying the diagnosis. This part is helping you make sure that you're coming up with the best diagnosis possible by critiquing it, and critiquing it by talking about some of the things that is limiting your ability to make a strong diagnosis here. Now, it could very well be that your client meets all the symptoms, which is unlikely, but very possible. In there, you can talk about how you can't find anything to critique the diagnosis, which is very rare. But again, you should be able to find, and even if you can't, and your client meets the full symptom criteria, you can still talk about how those symptoms may be impacted by another disorder. And it may also be a disorder that's in the same group, such as mood or trauma. So you might want to compare other disorders that are within the same category of disorders and make a call for why one is more stronger than the other. You also want to look at frequency, how long the symptoms have to be occurring, um, how often they have to present in the client's life, what's the duration of the disorder. All those things are also important, and you can also talk about that in your critique of the diagnosis. So you may say, oh, in order to make this diagnosis, client needs to be suffering from this disorder for 4 weeks. My client had only reported that suffering for it for the last 3 weeks. So I would feel more strongly if there was another week of symptom report to make a firm diagnosis. That is another example. The other thing is you want to also make sure that you're writing the full criteria for the disorder too, because you might find out you wrote some things in the case presentation that negates the disorder that you're identifying. So for instance, give an example the same example I use in terms of frequency and duration. You might write in your presentation of case information that your client has only been suffering from a disorder and its symptoms for 2 weeks. But when you write down the full criteria, it may list in that full criteria that in order to give this diagnosis, the client has to be suffering for at least 4 weeks. So that will mean your case presentation information contradicts the symptoms required to make the disorder, to make the diagnosis for that particular client. So again, you want to make sure that your DSM-5 diagnosis aligns efficiently, smoothly with the case presentation information. And then when you get to the critiquing of the diagnosis, you also want to make sure that you have not listed any information in the presenting problem section that may rule out the ability to even give that diagnosis. And that's what we're talking about as well when we're talking about critiquing the diagnosis. So I hope that was helpful. That was just some of the feedback that I wanted to give you all on the case study assignment, and I hope you found that helpful for you. The reason why it's important that I talk about it with you today is because, again, assignment 2 and 3, but mainly 3, is very similar. And so if you have a better understanding in how you were to do this assignment, my guess is that your next assignment, even the group assignment, and the final case study will be written up a lot better. Again, just to revisit, you are to be growing these skills. So it's not expected that students will be coming into this point and being able to be able to do this. But these are skills that we're trying to grow and make you better clinicians in the field. Another thing that's very important about this course is that it will position you well for the licensure. So when you understand how to look at this case information, when you understand how to understand diagnosis and symptoms, that'll put you in a very good place to pass the licensure. That's it for me in this video. Please continue to look at your announcement. I will be sending out some important information through your announcements about your assignment. Thank you for taking the time to look out for this video and to watch it in its entirety. And it's a pleasure teaching you up until this midterm point of the semester. This is Dr. Janine Cross, and you know how to get in contact with me if you need me.